Hello and welcome to the International Nurses Week and the International Day of the Midwife. So today it's about us talking about midwifery, talking about services. What is it all about? We are celebrating being midwives, being nurses, and I have been your midwife. So today I would like to say all about midwifery. I love midwifery and nursing. It has brought me far. I came to know that somebody told us that among the best moments in a person's life is when you realize your purpose. And it was great for me to know the purpose of taking care of women in midwifery. And I felt like it was the best time, just knowing that purpose. So I love midwifery. One of my best moments in midwifery is when I see a mother and her baby smiling after that frustrating moment of being in pain, being anxious, and then leading her to a good outcome, a time of enjoying a good outcome with a baby. So that has been one of my best moments. Another good moment that I have enjoyed in midwifery is the moment I help a mother come out of a situation and a bad situation. There are mothers who come with complications, and the moment I help that mother and at last she smiles, it is the best moment. Another time is when a mother tells me, "Thank you, God bless you." It is the best moment. The moment you receive that good word and kind word that shows you it has been great being served by you. So offering services as a midwife is among the best experiences for me, and I think I enjoy them a lot. I do enjoy. And today I would like to tell you some of the things that a midwife can do to your life. What is the need of a midwife? Why do you have to come to clinics all the time and looking for a midwife to take care of you? The purpose of finding a midwife, it is because you need to know, how do I go about this? From the before conception, you need a midwife's care. That is advice and monitoring. For example, the assessment that you will go through before conception, this assessment is very vital for the health of the baby and also for the health of the mother, because we want a good baby. We want the moment we have the first cry, it's all a bundle of joy. So this starts from preconception care. So the moment you come to hospital, you might be asked to take some supplements or to undergo some tests for you to be able to have a healthy pregnancy. Secondly, why you need a midwife? It is because the family integration in pregnancy is very important. So it is possible to start integrating the family as early as possible. It is a moment when a spouse or a partner or the other family can get a chance. You can come for clinic checkup with your family, and everybody is explained to what is pregnancy, what do you need in pregnancy, how is the support system, how can the support system be established early and well in pregnancy. So these are the many great reasons that you need to come for clinics. So there may be bad experiences that we have had before, maybe when there is a bad outcome, or when a mother comes and the complication is already too far and you feel like the mother is already so sick and all that. So coming early for clinic just cuts all bad things off. So we would want to celebrate the good moments more. And with this, I would welcome you for midwifery care. Always seek midwifery services. They are available. Any questions, ask. You're free to ask at any time. The definition of a midwife tells us well that it is our time to work with women and to take care of them. So you are welcome anytime for the care, for the support, advices. Any advice that you need is available. So I would say thank you so much to my clients who have made me feel good being a midwife. The moment a client becomes good to the midwife, it is not The midwife can be good to the client, but the opposite happens to the midwife. So I would like to thank my clients so much for being so good to me and for making things look beautiful. I think I've enjoyed midwifery so far. It has been a wonderful time, and I don't regret it. I want to just get deeper into it. So, including my colleagues, at times we just joke around and make work look beautiful. So, thank you to my colleagues, my classmates, my lecturers, who have made me get knowledge so that I offer evidence-based care. It has been great, and thank you so much for the passionate training. Thank you very much. So thank you, and have a wonderful time. Welcome for midwifery services. Thank you.
My name is Elizabeth Musili. I'm a midwife student. I would like to celebrate this week with my fellow midwives. I'm very happy to be part of this celebration this week. I would like to appreciate all the midwives for the good work they are doing all over the world. They are working hard to achieve a good health for the mother, the newborn, the family, and the community at large. It's the joy of a midwife to deliver a baby who is free from complication, who is healthy. And all this can be attained by having a good preconception care, good prenatal care, good care during delivery, and postpartum care. A healthy mother is a healthy nation. I wish you all well as you're celebrating this week. Thank you.
My name is Rosalyn Oling. I'm a nurse midwife. I'm happy because we are celebrating the Nurse Midwives Week, and this time around it has been integrated together, meaning we are celebrating the nurse and we are also celebrating the midwife. Midwifery Week is actually meant to honor the midwife's work on how the midwives take care of the mothers and their newborns. Midwifery is a noble duty. It is a noble role that is given to us by God Himself. Why do I love midwifery? I love midwifery because it actually touches my heart. Just having to know that I am the first one to see a baby when the baby is born gives me joy in my heart. My memorable moment in midwifery during my care is when I see a mother come labor, and after crying all that time in pain, then poop, there is a joy. And the joy is actually the love of the baby that this woman carries home. What a joy to see the family rejoice. My saddest moment that I have experienced throughout my care was when I actually took care of a baby who was born a preterm for over 40 days. And then the baby actually died. This touched my heart, and it actually taught me a lesson that as a midwife is a very important person in the community and the society. That you touch these people from the time they are born to the time they leave. And I want to celebrate all the midwives in Kenya and worldwide that you are wonderful women and men. That even as you handle these mothers and their babies, that may God touch you, that you may be able to handle them well, that God may be able to lead you. And I am glad that I even managed and succeeded to actually join and progress on with midwifery. Thank you.
My name is Teresia Rashimo, a nurse midwife. I would want to wish everyone a happy Nurses and Midwives Week. During this week, we want to celebrate all the nurses and midwives all around the globe for the good work that they do. I want to talk about midwifery. Midwifery is my passion. I have always wanted to be a midwife. And why I love being a midwife, it's because of the satisfaction that one gets from being a midwife, having to work and help the mother in delivering the child, having a good outcome of the mother and the child. For this to be a realization, it is very important that the mother has very good follow-up. That is before even she conceives, even throughout pregnancy, she needs good follow-up, whereby all the interventions that can be done in a timely manner, so that they can ensure a good outcome for both the mother and the child. Let us continue working for the good work. Let us continue working well to help the mothers and the infants to have good outcomes.
My name is Gatcha. I am a proud nurse working in Nyeri County. I qualified in 2007, so I've been on the ground working to help the mothers and the clients who come for services, and especially reproductive health services. That is my best department because I meet mothers from all tribes, mothers of all ages, because we even have the teenagers who come to seek for services, even for family planning. We've incorporated the youth in our clinics, so I get a wide variety of clients. But my best is where I see the mothers in antenatal clinic. I see them through the antenatal phase, and because my facility is a health center, I see them even when they come to bring their babies in the clinic, and also for family planning services. It gives me joy to see these mothers as we've become even like friends. We serve them, and when I see them coming back again, I truly believe that I'm offering the best for my clients in my county. So this week, I'm celebrating myself as a nurse and celebrating many others who have chosen and who are called to do this and offer services for our mothers especially. And my best wish and greatest wish this week is we have many men getting involved to bring their women to the clinic, because we work as a team, and also we cover it as a family, the father, the mother, and also for the baby. So I have a few things to say about myself. I've had my best moments and also my bad moments. Of course, I'll start with my greatest moments, where I've been able to reach many women to come for cancer screening. That is the cervical cancer screening. I've been able, at least every Wednesdays, that's the day I schedule the day for the mothers for screening. And I'm proud to say that through the training of cancer screening, we've been able to reach mothers who have even the precancerous lesions, where we give them the treatment after now the lesion has turned positive, or even when the results have come out positive. If it's a negative lesion, we usually see them 3 to 5 years. And even these who are HIV positive, and especially the mothers who come in the PMTCT, we see them every year. And I'm happy that they keep the dates. They come every year. This test is free. It is just a 2-minute test where you get to know the status of your cervix. And most mothers appreciate. Even when they come, the follow-up after 1 year, we see the changes. The test is negative, and they appreciate. So my other greatest moment is where that I'm a student now. I've gone back to class to gain more skills in the midwifery and how to take care of a mother in labor and her baby, her newborn, and also the family at large. This came about when I was called at home. I was having my off duty, and a neighbor went in labor prematurely. So I was called to help this mother at home. And unfortunately, or fortunately, I was able to help the mother deliver. But unfortunately, this baby was a stillbirth. And it was a macerated, meaning the baby had died inside the womb So it really called me, and it gave me an awakening eye that I should go back there, get skills, and also have I get to involve my community so that they get to know the dangers, the preparedness in pregnancy and also in labor. So my worst moment, had several, but my worst of it was when I was not able to serve a client. This was a gentleman who wanted some, he was a psychiatric patient. He wanted some help, and unfortunately we didn't have the medication. So when I went to explain to this client that there were no medication, he got furious, and I was not able to control him, to a point that he threw a book. He was carrying his book, he threw it to me. And I felt so down that I could not deliver the service to this client and offer the best for this client. So at times, as a nurse, you feel you're not able to achieve, you are not able to give your best to your clients, however much we want to say health for all. So it's my call that when we are serving our clients, we get to learn from them, we get to have what they want so that they can achieve their visits. They have the best visit in the facility. So yeah, I'm inviting mothers and young of all reproductive ages. Here in our county, we want no mother to die. As we sing Vision 2030, we want no mother to die out of the cervical cancer. It is free in Nyeri County, most of the facilities we are offering. So any day you're welcome. Karibuni sana mothers, so that you go have your status checked, your cervix, your breasts, because it's the second killer disease. And we have qualified nurses who are very skilled, who are willing to serve our mothers and our clients. So you are most welcome. May God bless you all. May God continue giving us good health. And as we achieve this, may the Almighty God keep us safe. And I celebrate you all nurses as I celebrate myself. Thank you very much.
Ninashukuru sana wakati nilijifungua huko kaunti ya Nyeri. Nashukuru kwa madaktari kwa kututunza. Nilifurahia wakati nilijifungua, niliona madaktari wakikuja kila wakati kuangalia mtoto kama ako sawa, kama mtoto ananyonya, kuangalia mtoto kama ana shida ama mtoto hana shida. Nilishukuru sana sababu ni saidi za nyumbani kwetu, ukijifungua after 1 hour ni kurudi nyumbani. Hata ukijifungua huwezi jua kama mtoto ana shida ama hapana. Kwa hivyo mimi nilishukuru kuangalia mtoto, kaona mtoto ako sawa, pia kwa kutoka vizuri, walitulea vizuri, tulikula vizuri, sikuona shida yoyote tukiwa huko. Kwa hivyo nashukuru sana.
I wish all nurses in Nyeri County and beyond a happy International Nurses Week and the International Week of Nurses. Thank you and enjoy yourselves.